Hi everyone, this is Dr. Ashwini from the Holistic GP podcast. Today we are going to speak to Dr. Emily Hoschitz, and she's a cardiologist based in Melbourne. And this is a follow up from our heart episodes they've been doing. So we are really excited to welcome Dr. Emily into our show today. Hi Emily, how are you?
Oh, hi. Thank you very much for asking me to join your show. It's very exciting to, I suppose, give out a message to patients and people about how to keep their hearts healthy.
Thank you. Now, Emily, before we get started, so can you just, because I got excited seeing your profile, because usually we speak to a cardiologist, we speak about heart attacks, that's the common thing. But you're an electrophysiologist, which, people may not know what that
Mm.
is. So can you just give us a bit of data about yourself and how did you get into this field?
That's right. So I'm a cardiologist and an electrophysiologist. So now we subspecialize. So I'm like the electrician of the heart, whereas a heart attack's a plumber of the heart. So we do general cardiology training and then specialize in electrophysiology, which is like racing hearts, cardiac arrest, pacemakers. So my specialty is in those type of areas. I day to day do consulting with patients, but do procedures like pacemaker implants, defibrillators, and ablation procedures where we try to fix people's racing hearts.
Nice. Now, I'll just give an additional for people who don't know. So, her interest includes atrial fibrillation management, which is like with catheter ablation, device implantations, and stuff like that. So, now when we get started on this, Emily, can you just give us a brief outline on what is atrial fibrillation? How does it occur? And what is the complication of it?
So atrial fibrillation, or we call it AF for abbreviation, it's irregular heartbeat. And it's something we're seeing more and more with our Western lifestyle. So, unfortunately, as we don't do as much exercise, we're overweight. As we get older with different diseases, our heart's prone to do this irregular heartbeat, or AF. So, there's many causes that contribute to it, but anybody is at risk of it potentially. The main problems about fibrillation in the long term are symptoms, and then there's an associated risk of stroke, particularly when you're older. So we like to fix patients so they don't have symptoms. And if you're over 60, we really want to treat stroke risk with medication to avoid that as a reason why they might present to hospital.
So, somebody out there, how do they know their heart rhythm is not working correctly?
So many people will feel symptoms like palpitations, thumping in the chest, a jelly-like feeling, butterflies, but some people don't at all. And so those patients, you might pick it up on a wearable device, a watch that might say something's wrong, irregular beat. Checking your blood pressure, it says irregular beat, or feeling your pulse. And then other patients, when they see their GP who's checking their pulse and measures something as irregular.
Okay, so that's an important thing. So anytime we feel irregular heartbeat, and that's why we check it. But often it's important to be investigated also. I'm sure because there's thyroid and other issues that can cause all these conditions. Now, I like that you mentioned it's our lifestyle that actually contributes to it. So, can you just give us an outline, Emily? How can we all lead better lifestyle to prevent this? And what
Mm.
are the specific condition that triggers an AF in the population?
So, yes, when patients have AF, we know that if you do some regular activity, and that only has to be walking or some form of exercise, 15, 30 minutes a day, you'll have much less AF in the future, less symptoms, makes it more manageable. The next thing is diet. So most people are pretty good with their diet, but avoiding high fats and more importantly, avoiding alcohol. In an ideal world, you'd have no alcohol because that triggers AF and affects the heart. But some patients, 1 or 2 glasses can be okay. But if they can't stick to that, it's better to have no alcohol. Alcohol also leads to weight gain, and being overweight and weight gain also increases your risk of AF. So once again, back to doing exercise to lose weight and diet to lose weight will mean you reduce your risk associated with of AF progressing. And if you haven't had AF, by doing these activities, you'll make it much less likely.
And I like that you touched on alcohol. Now, there's a myth, right, that alcohol is good for heart. But where did that come from? And can you explain to us why does alcohol trigger AF?
So, a myth or a sort of some knowledge came out when they looked at red wine in terms of helping coronary disease. And there is some studies that showed a certain dose of red wine, for example, could be beneficial. And it's quite particular to the type of red wine and the content. So it's not all types of wine, and it's not a large volume. In terms of AF, alcohol is not beneficial at all. And what alcohol does, it's cardiotoxic, so it affects the cells in the way they function so that they fire off to cause AF, but it also can make the cells weak, so your heart muscle can get weak, which is heart failure. And that combination is very bad to have, makes you very breathless. But recent data in the last 2 years that we've been involved in showed if you cut back your alcohol or stopped, you had much better outcomes. So it's treatable or reversible.
So we can reverse AF with a lifestyle change?
Almost definitely. So there was a nice study out of Adelaide that actually showed if you have regular AF and you do these lifestyle measures, in particular losing weight up to 10 kilos, it's like taking medication. The problem patients have is a tablet's easy to take, whereas doing the lifestyle things is hard. But you've got to see the big picture. Doing the lifestyle things is good for mental health, for the rest of your body, for your knee joints, and for longevity. So you have reduced falls if you're older with more exercise.
What about stress and AF? Is there a connection there?
That's a very big connection. Yes, stress is a big connection to all parts of the heart. When you're stressed, it has the what we call a sympathetic nervous system, so a lot of increase in heart rate, increase in blood pressure, and it affects the heart in a lot of ways. If you have AF and you're having more stresses, you'll have more episodes, it'll be faster, it'll feel worse. And on the other side, if you can reduce the stress, which often exercise helps or holidays, you can have much less in the way of symptoms.
Great. So we know that we have to look into diet, cut off alcohol, exercise, manage our stress. Now, is there predisposition in gender with
Yes, with AF.
AF?
What we've learnt lately between men and women is they're very different heart disease. So, for example, heart attacks present different in men with a lot of chest pain, and women just feel breathless or nausea. With AF, they're both affected, men and women, but may present with different symptoms. Women often feel just breathless rather than thumping palpitations, so often are incidentally found. And the way that the heart responds to the AF is in heart failure or heart adjustments is different to men. So they may get a more thicker heart, or they may get heart failure without changing a lot on their ultrasound that we look to check their heart.
So, from your advice, when should women start? Because, like I said, often their presentation is it's not typical. When should women start getting heart check, and what should they be discussing with their GPs?
The main changes in a woman is when you go through menopause, the increased risk of heart attack and other cardiovascular disease increases. So that would be a primary point of contact with a GP. But prior to that, I would say most women should be exercising, should be looking after themselves, and maybe wearables mean they can pick up their heart rate change. But certainly by 40, having a checkup with a GP who can pick up risk factors for heart disease, such as blood pressure, cholesterol, diabetes, the stresses, to pick up the things that you won't notice before they're causing a disease process. So you're treating a risk factor before it translates into heart disease.
Thank you. So that's great advice. Also, menopause and heart disease. Can you just explain a bit of that to us? And how can women in perimenopause and menopausal age group manage their heart better?
Yes, so this is an area that's had a lot of research over a long time. Once again, trying to find a simple answer when there's not. We know that through menopause, the estrogen levels are changing, and often weight gain occurs and different other symptoms with menopause. But these effects on the heart then translate into potential heart disease, not in everyone, just in a group of patients. The best way to counteract that is what we talked about, the lifestyle factors. So more regular exercise, keeping the weight down, watching your diet will counteract a lot of those effects. Once again, it's not a magic pill to just take hormone replacement and think just take the hormones and don't go through menopause. That's not the easy answer. And the studies are conflicting in terms of outcomes. It's better to keep yourself as healthy and as well as possible to avoid the heart disease down the track.
Thank you. Now we've got a question from one of our listeners, and the question is, can a minor heart attack be mistaken for a hot flush or other menopausal symptom in women?
Definitely, yes. So with menopause causes a lot of different symptoms and very different between women. The second thing is heart disease in women. A heart attack, angina, or chest pain type symptoms are often very different to men, very different to what they may have read about. So it can be just jaw pain, it can be heaviness, it can be I'm a bit breathless, tired, nausea. So I think any woman who's feeling I'm not quite right, or I don't feel well, or something's wrong, if you go to the GP, they help you tease that out, and they can help check you for the risk factors and whether you may have some heart disease.
So on coming back to that, so you said that HRT does not necessarily prevent heart complication and heart issues, but there's also certain studies that said yes, HRT is beneficial, in the time frame for heart health. So
it's a very individual process. Yeah, we tried to find an answer for the whole community, and it's not that simple. So that's why the message is really coming down to the individual that sees their GP and checks those risk factors to work out, and symptoms, what's beneficial.
I agree with you. I think it's a very personalized approach, and we need to see everyone as individual. Now, another of your interests I noticed, Emily, is pediatric arrhythmias in children. Now, how often is this, and because like you said, bad lifestyle, alcohol is what we are seeing in adults. So what is the pathophysiology and how is it occurring in children?
Yes, for children, so very young as toddlers or babies, that'll be congenital heart disease picked up by routine screening with general practitioners. But from once they're school age, primary school, secondary school, often kids will have symptoms they don't know. It's not normal for your heart to race. They don't know to report that. And so often it's picked up by not keeping up with others, feeling a bit faint or funny. And it's when a child reports some symptoms like that, keeping an open mind as to what that is. Why children might get arrhythmias is often just a short circuit in the heart. The rest of the heart's fine and works well. It just races periodically. And it's generally not life-threatening. So then you can wait till there's a time that they report the symptoms to then manage them. And we can fix that with an ablation procedure. But we try to do that once they're full size, so through adolescence. And so given it's not life-threatening, we tend to watch and wait until they're that size before treating.
And is there something parents can do to prevent this, or what are the lifestyle strategies we can manage?
So with children, unfortunately, the same issues with adults. They're more sedentary. They're watching computer games and not doing as much activity. So same thing, we need to be making sure they're out and about doing incidental exercise as well as structured sport, watching their diet. Most children learn their lifestyle from their parents. So you need to be out and about, not smoking, exercising, eating well, and demonstrating that for your children. Many symptoms with coming through COVID and restrictions, palpitations, anxiety, things like that, will respond to these type of measures. So even if children do have what they think is racing heart or palpitations, a lot of it will improve as they do these lifestyle measures.
Now, Emily, this is another question just popped up to me, is now we are diagnosing more and more ADHD and ADD in the population, adult and children. With stimulant medication, now the new advice is always to get a cardiac assessment and ECG, when we are starting. Are stimulants affecting the heart? Are you seeing that happening in the community?
Once again, you're treating a condition that's a systemic problem. So with ADHD, there's some overdrive brain signaling that's happening that can affect the heart. So whatever's going to manage that primary problem would actually end up benefiting the heart. There's only a small portion of people who might have a predisposition in their heart that should avoid those type of medications. That maybe they have very prone to racing, not just this general type of racing or fibrillation, for example. A lot of arrhythmias occur when patients are not well. So if you can treat their primary problem like ADHD or a bowel upset or something else, the arrhythmias settle down. So you do need to make sure you're treating that primary problem first. And we tend to just check the heart, and watch it along with the treatment rather than ban the treatment, for example.
Okay. And in terms of children, and like you said, sometimes we can wait and watch. But at what point should we not wait and watch and, be aggressive in treating them?
Yes. The number one thing is when they're not keeping up with their peers. So if they can't run around with their friends, concentrate in school, different behaviour. So that's a key that parents might see or teachers might see. The second thing we look at is heart function on an ultrasound. So if they have an echocardiogram, which looks how the heart's pumping and it looks nice and strong, that's good. But if it doesn't, then that might be a key to acting earlier. So we do pediatric echo, for example, and a pediatric cardiologist can assess those type of things when there's a concern about the associated symptoms going with that.
But when we find arrhythmias in children, is it possible they can lead a normal life like all their peers and be active and travel and...
Oh, definitely. So if you've got SVT or even AF when you're younger, you can do all those things. But there's just intermittent symptoms. And I suppose when you're younger in onset, we want to find or do a treatment that's curative rather than just do tablets. So if you have racing heart and it happens twice a year, you can still travel, but it's very inconvenient if it happens when you're overseas. So we tend to look at more permanent fix in patients that are younger so that they don't have these lifelong problems.
Great. So the number one thing what I'm hearing is gets checked. We'll refer to cardiologists when needed, and there's a lot of help out there. Now, I also notice, Emily, you enjoy running marathons. So now, when we have patients who love extreme sports or marathons and they're having issues with their heart rhythms, can they continue those sports?
It's another area that's become quite intensely researched lately is how much exercise is too much. And once again, there's a portion of people that shouldn't over-exercise. We're talking 4 or 6 hours a day, so heavy training for extreme sports may cause a problem in people. But generally, people who have arrhythmias and have normal heart function can exercise and train and run freely without concern. If you're having an arrhythmia, often you feel worse running, so you can't do it at that time. I think the key is knowing what the actual rhythm problem is, knowing their heart function, because that will guide the prognosis and how we manage it. There's always that 5 or 10% that have a very dangerous condition or a concerning condition, and that's where the cardiologist needs to just pick those patients so we can watch more closely. But almost everyone can exercise within prescription. Despite heart disease, like we want to manage exercise to go along with cardiac disease.
And is there anything that is a big no, or should every patient with a cardiac history see an exercise physiologist to understand how to optimize their exercise?
The answer is yes, everyone with a cardiac condition should see some sort of exercise program. So everyone who goes to Holmeskin Hospital where we work go to cardiac rehab afterwards, and that's to learn about the heart as well as the type of exercise. The big no's are only heavy weightlifting and taking supplements at the gym. That's a big no. But everyone, even with very poor heart function, can do mild exercise. Very elderly people can do mild exercise. It's just being within reason for their activity level. There's no one we formally restrict except about a handful of genetic conditions. Even then on treatment, they're able to exercise, even with defibrillators. So you can see the World Cup's on at the moment. There's soccer players who have defibrillators who can play competitive sport within treatment guidelines and observed by their cardiologist.
Great. I think that's been a good understanding and a quick summary on, rhythms and atrial fibrillation. Now, I notice another of the interesting thing that you practice is in the area of cardiac failure, heart failure. Now, to the general population, when we say heart failure, often they don't understand what we're talking about. How does the heart fail? Can you give us a quick guideline and how lifestyle also affects the heart in this area?
Heart failure means the heart pump isn't working as well as it should. So that can be extreme, so that you're really breathless and full of fluid, or it can be mild, and that's the majority of people is mild or moderate. The heart muscle gets weaker You get a bit more puffy, tired walking. Very treatable. Start some medication or sometimes pacemakers. It'll help you feel much better, help your heart muscle get stronger. Once again, exercise is going to improve that situation. Some people have this as a consequence of heart attacks. So if you can prevent heart attacks, you're going to prevent heart failure as well. The heart failure just means it's not working the system's not working as well as it should. So there's various forms of that and various severities. So it is a confronting word when you say it to a patient, but it's more to talk about the pump function.
Thank you. So I think that's been a great overall you've given us. Is there anything else you would like to speak and inform our listeners?
It's just my main message, which I harp on to every patient, is exercise daily. Drag a friend along with you because it makes you feel better. And and laugh once a day, because negative emotions also associated with heart disease.
Thank you. And is there anything you have read or listened to that's really inspired you that you'd like to share with us?
I think it goes back to the patients I see each day, like an 89-year-old woman who's still doing her yoga and is able to stand up from the floor without using her arms. And you think that's because you've invested the time and effort into looking after yourself, and you think that's what I plan to do. So that's why I keep running.
Great. Thanks for coming today, Emily. I mean, I think it's been a pleasure having you. You've given us good information. Is there anything you'd like to ask me or tell our listeners before we go?
Do you exercise?
Yes, I do. I love walking my dog and I do yoga. I know I should do a bit of HIIT, but I'm just not a gym person, so I like outdoor.
Yes, I think a dog is a great idea too. That's what drags people out every day.
Yeah, I know, right? Like I wish I could be as persistent as my dog. He will just wait there till I take him for his walk.
Yes, exactly.
So where can we find you, Emily?
So my main work home is at Melbourne Heart Care in Brighton and in Homeskin Hospital Moorabbin. We have sites all around Victoria, and I do a country clinic as well. But you can ring our main office to find me.
Are you in social media?
My office is. I don't have time to post lots of things, but yes, you can look on Instagram for Melbourne Heart Care.
Thanks for that, Emily. I mean, it's a pleasure talking to you today.
Okay, thank you.